Oh yeah! Day in the life of a veterinary neurologist. Let me get the pink sheet. Important stuff happening. Day in the life of a veterinary neurologist. Jason Mraz is touring again this summer, so I am ready in 16 minutes. Tickets go on sale, 15 minutes and 56 seconds. So we had two that we saw yesterday afternoon. Just it was getting into like 8 o'clock at night, so decided it was medically appropriate to wait until today. And just they are both French bulldogs. I'd rather do the MRI in the morning and have them recover while we've got full staff here, as opposed to in the evening, and just in case there was any sort of problem. So one is in the scanner now. It's Lucy that had 3 episodes of becoming off balance, recovers very, very quickly. We did the MRI, and there's otitis media interna, so an infection in the middle and presumably inner ear that's causing these balance problems. Many times we can manage them with systemic antibiotics. Usually we'll give like a 2-week course of antibiotics, and if we see a strong response, we'll continue it for a total of 8 weeks. Many times just the pus or gunk, for lack of a better term, is so inspissated or stuck in the middle ear that surgery is necessary to sort of drain the pus from there. But that's sort of we try the antibiotics first. So even though on Lucy's MRI we can pretty clearly see the otitis media interna, these dogs will usually do a spinal tap as well, just to make sure that there isn't any evidence of extension or meningitis or encephalitis caused by extension of the middle and inner ear infection, just because the bone there is very, very thin and it can easily sort of break through and cause a meningitis or encephalitis. This is crazy how fast they're going away. So we're going to Indianapolis. I've never been to Indianapolis. Cool. Michael, I'm going to Jason Mraz. Look for the Good live summer tour 2021. I've earned 12 free meals from HelloFresh.
I know, that's so annoying.
I can get Serious, no thanks. I can get a trial set of razors.
Cool. I have Alice, 1-year-old female spayed Cocker Spaniel. When she was around 7 to 8 months old, she had her first seizure, but the owner didn't know it was a seizure until about 1 month ago had another one. And then again last Wednesday and last Friday. But the one on last Friday, she actually fell off the bed. It looks like a cow.
Look at those eyelashes. Look at those eyelashes. What are we doing to you, huh?
Hi.
Crazy.
Hi. Oh my goodness, she's so cute.
Wong? What am I doing to you? Normal exam. We are first going to try and figure out, is this a seizure based off of the description. They've got videos that should help as well. Yes,
Oh, nothing. Tap is normal.
Thank you.
You're not on the phone, are you?
I'm not on the phone.
Okay.
I got my Jason Mraz tickets, but like everything, it's like all standing room only. It's like general admission, and it's like
That seems less COVID compliant.
seems
than
less COVID
seats.
compliant. Exactly.
Where are you going?
Indianapolis. Never been there.
Me either.
It's fine.
It'll be fine.
Randy Cross is in Indianapolis. Randy, we might be coming to see you.
Yes, hello?
Hi there, it's Dr. Wong inside Southeast Veterinary Neurology. How are you?
Good, and you, doctor?
I'm doing well. So I just met Alice. She's super cute. She came in here wiggling her butt, and very, very excited to meet everyone. So my understanding is she's about 1 year old, and she had her first seizure maybe at around 7 to 8 months old, but we weren't weren't sure until more recently when we've seen more that that's what it was back then. I've seen the video here that you sent, so thank you for that. That's very, very useful to see that, and I know it's kind of hard when something's happening like that to sort of have the the presence of mind to shoot a video. The video is very helpful in that it does look like a seizure. What a seizure is an abnormal burst of electrical activity in the front part of the brain. So a seizure is not a disease. A seizure is a symptom of a problem with the brain. And there are three main things or three main problems with the brain that we can have that can cause seizures. The way I think of causes of seizures, I think of them in three main different categories. The first category is something outside of the brain that affects the brain to cause a seizure. The easiest example is a poison or a toxin. I don't think Alice is getting into a toxin 4 different times now, but just as an example, something that's not physically wrong with the brain, something outside of the brain that affects the brain. And the next thing would be something like low blood sugar and liver shunts. So my understanding is that you've got a bile acids test scheduled for tomorrow, and I agree. I think that's sort of the next step we should be taking in order to try and figure out the underlying cause of these episodes. And after you've done the bile acids, we will have kind of run the gamut. We would have done all of the tests for things outside of the brain. The second main category of causes of seizures is something physically wrong inside of the brain. So a structural problem inside the brain, the brain having something abnormal within it. Examples of that are things like brain tumors and strokes. I would be really surprised if Alice had a brain tumor or a stroke. I'm more using those as just examples that, people that don't have a medical background, kind of make sense to them. The things that I do worry about in a 1-year-old dog as a physical structural problem inside of the brain would be some sort of malformation. So dogs can have fluid pockets in the brain or cysts. They can have other malformations in the brain. They can get infections of the brain. They can get inflammation of the brain. So those are the things that I think about in a 1-year-old dog, of things physically wrong inside of the brain. And then the third main cause of seizures is what we call idiopathic epilepsy. Idiopathic epilepsy means recurrent seizures that aren't due to a problem outside of the brain and aren't due to a physical structural problem inside of the brain. It just means that the cells that make up her brain, called neurons, are inherently more excitable than a normal dog's brain, and just make it more likely that the normal amount of electrical activity is going to spike or increase into this seizure level of electrical activity. There are a couple generalizations we can make about dogs with idiopathic epilepsy, But the only way I can truly diagnose that is by ruling out all of the things outside of the brain with blood tests, which is what you're doing, and then rule out things inside of the brain with an MRI. The results of these tests may change what medicine we're giving and how we're managing. I guess what I'm trying to do is prepare you that there's a fair chance that we're going to be on medications for life.
Okay.
Well, what I'll do is I'll have them bring her on up to you. I'll write up a summary today. I'll leave a note for us to call you on Tuesday just to check in and see how things are going and just touch base about the results of the tests. I would call over to Coral Gables right now and see if they'd be able to see you today so that we can get the ball rolling. Had a good one. What do you give a sick bird?
I don't know.
A tweetman. Hi, Mama. It's Dr. Wong. I met Beauty. My understanding she's 11 years old. And for the last couple months, we've noticed just her being in a fog and sort of walking wobbly and just seems to be a little disoriented and not mentally completely clear.
Yeah, Dr. Hardy used to openly admit to me that he thought she was one of the brighter dogs that he's ever had who was in practice. And she doesn't even remember all the routines. She's forgetting them. It's like everything's getting away from her. I'll say, Beauty, let's go out for a walk. And she stands there like, what is she saying? And, I take her, there were a load of rules that she always obeyed. Like, she walks out of my cul-de-sac out onto the street before she does her business. A couple of times she did it right in front of my neighbors, or she peed in the house. She never went in the bathroom because the cat's litter box was there. I mean, all of these things, in a matter of maybe 3 or 4 months, all of this has changed.
I noticed her right front paw, sometimes when she would turn to the left, it would start to turn over. Instead of standing on the bottom of her paw, it would start to slide and get on the top of her paw. Those are things that are subtle, but that's kind of my skill set, is to sort of see the subtle stuff that may or may not have significance. But when I hear 11-year-old pit boxer mix with behavior changes and not being quite as mentally focused, and then I see a subtle tendency to turn to the left and subtle weakness on the right side of the body, it makes me worried about a problem inside of the brain, more off to the left side. The examination can tell me where generally the problem is, but it doesn't usually tell me what the problem is. So I can come up with a list of possible causes that we see in 11-year-old pit bulldog boxer mixes, and the one that I worry about the most is unfortunately something like a brain tumor. Occasionally we can see things like an Alzheimer's condition, or what we call cognitive dysfunction syndrome. Occasionally we can see something like a degeneration or inflammation. Rarely we can see like an infection. And stroke, while strokes do happen, usually those come on suddenly, as opposed to this sounds like it's been more insidious and progressive over the last couple months. So while strokes do happen, that's not highest on my worry list.
I'm recently widowed and retired. Now, I'm widowed a couple of years, but we will make it happen. She is a wonderful rescue, and being alone in my house with nobody there, no kids, no husband, I don't have kids, she was my world and got me through the pandemic. We will do it.
So you want me to see one more new consult? Will that work out timing-wise?
Let me ask you. You can see one more new console, right? For timing-wise? She said, yeah, you can do whatever you want. Yeah, that's fine.
I need direction.
Yeah.
Okay.
Yeah, that's fine.
High five. When I was a kid, or was that the Kool-Aid guy that would bust through the wall?
Oh yeah. Uh-oh. Huh?
Yeah.
Say, oh yeah. She did fine with anesthesia, so made it through anesthesia fine. I did find something that is the cause of all the symptoms, the spacing out and the walking in circles and the walking drunk. It looks like it's a brain tumor. No one can be 100% sure that it's a brain tumor without biopsying it, but it's not in a part of the brain that's easily biopsied. And it is a classic appearance and classic location for a type of tumor called a meningioma. Not what we wanted to find for her, not completely unexpected. At least we know what we're dealing with now, and can make some recommendations to try and help. I guess my approach is, she had this whether we looked or not. Now that we looked, we know what we're up against, and we can start doing something about it to try and help. So